This slide covers 3 key topics in pathophysiology for drug inspector exam preparation. The topics are: number 1, sexually transmitted diseases, or STD, and AIDS; number 2, hypersensitivity; and number 3, hepatitis and HBSAg. This material was prepared by Assistant Professor Akash S. Jayapaya. This slide covers sexually transmitted diseases, or STDs. Definition: infections transmitted primarily through sexual contact, including vaginal, anal, or oral. Common causative agents. Bacteria include Neisseria gonorrhea, which causes gonorrhea, Treponema pallidum, which causes syphilis, and Chlamydia trachomatis, which causes chlamydia. Viruses include herpes simplex virus, which causes genital herpes, and human papillomavirus, or HPV, which causes genital warts. Protozoa include Trichomonas vaginalis, which causes trichomoniasis. Pathophysiology. The process begins when pathogens enter through mucosal surfaces, such as genital, oral, or rectal tissue. They multiply locally, leading to inflammation, ulcers, and discharge. Some pathogens, like syphilis or HIV, enter the bloodstream, resulting in systemic infection. Chronic infections can cause severe long-term effects, including infertility, pelvic inflammatory disease, or PID, and cancer, such as HPV leading to cervical cancer. Topic number 2, acquired immunodeficiency syndrome, or AIDS. Causative agent, human immunodeficiency virus, or HIV. Transmission occurs through sexual contact, blood transfusion, sharing needles, and mother-to-child transmission. Pathophysiology of HIV. 1. The HIV virus binds to CD4-positive T helper cells using the GP120 receptor. 2. Viral RNA is converted into DNA via reverse transcriptase and then integrates into the host cell's genome. 3. The destruction of CD4 cells leads to gradual immune suppression. 4. Opportunistic infections such as tuberculosis, candidiasis, and pneumonia, and cancers like Kaposi sarcoma begin to appear. 5. The AIDS stage is officially defined by a CD4 count below 200 cells per microliter, accompanied by severe infections or malignancies. Summary slide of pathophysiology. Part 1, Pathophysiology of General Sexually Transmitted Diseases. These are infections transmitted mainly through sexual contact. Common causative agents include the bacteria Neisseria gonorrhea and Treponema pallidum, viruses like herpes simplex virus and HPV, and the protozoa Trichomonas vaginalis. The pathophysiology involves the pathogen entering through mucosal surfaces, leading to ulcers and discharge, and eventually chronic infection, which can cause infertility, pelvic inflammatory disease, or cancer, such as HPV-related cancer. Part 2, Pathophysiology of AIDS. The causative agent is the human immunodeficiency virus, HIV. Transmission is via sexual contact, infected blood, shared needles, or mother-to-child. The pathophysiology steps are: 1. HIV targets CD4-positive T helper cells. 2. Viral RNA integrates into the host genome. 3. This causes the gradual destruction of CD4 cells, leading to opportunistic infections like tuberculosis, pneumonia, and candidiasis, as well as cancers like Kaposi sarcoma. Finally, the AIDS stage is defined as a CD4 count below 200 cells per microliter with severe infection or malignancy. Section 2. Hypersensitivity. Definition: exaggerated or inappropriate immune response causing tissue injury. Types of hypersensitivity according to the Gell and Coombs classification. Type 1, immediate or anaphylactic. The mechanism is IgE-mediated mast cell degranulation, leading to histamine release. Examples include asthma, hay fever, and anaphylaxis. Type 2, cytotoxic. The mechanism is IgG or IgM binding to cell antigens, causing cell destruction. Examples are hemolytic anemia and blood transfusion reactions. Type 3, immune complex. The mechanism involves antigen-antibody complexes depositing in tissues, leading to inflammation. Examples include serum sickness and rheumatoid arthritis. Type 4, delayed type, or cell-mediated. The mechanism is T-cell-mediated inflammation. Examples are contact dermatitis and the tuberculosis test reaction. Section 3. Hepatitis. Definition. Hepatitis is inflammation of the liver caused by viral infection, alcohol, drugs, or toxins. Causative agents. Viruses, including hepatitis A, B, C, D, and E. Other agents include alcohol, drugs, and autoimmune causes. Pathophysiology of hepatitis. The virus enters the body, usually through blood or the oral-fecal route, and infects the hepatocytes, or liver cells. The immune system then attacks the infected liver cells, leading to inflammation and necrosis. This leads to liver dysfunction, causing symptoms like jaundice, fatigue, and loss of appetite. Finally, chronic infection may cause long-term complications such as fibrosis, cirrhosis, or liver cancer. 2. Hepatitis B and HBsA. The causative virus is hepatitis B virus, or HBV, which is a DNA virus. Transmission occurs through blood, sexual contact, and perinatally, from mother to child. HBsA, which stands for hepatitis B surface antigen, is a marker of infection. If HBsA is positive, it indicates active HBV infection, which can be acute or chronic. The disappearance of HBsA and the appearance of anti-HBs antibodies indicates recovery or immunity. Pathophysiology of hepatitis B. Step 1. HBV enters the bloodstream and targets hepatocytes, or liver cells. Step 2. The virus replicates inside the cells, which leads to immune-mediated liver damage. Step 3. This results in either acute, short-term hepatitis or chronic, long-term hepatitis. Step 4. Chronic cases can lead to severe complications such as cirrhosis or hepatocellular carcinoma, which is HCC. Pathophysiology of hepatitis and HBsA summary. Hepatitis is defined as inflammation of the liver caused by viruses including hepatitis A, B, C, D, and E, or by other agents like alcohol, drugs, or autoimmune causes. Chronic infection may lead to severe conditions like fibrosis, cirrhosis, or liver cancer. Now for hepatitis B details. The causative virus is the hepatitis B virus, or HBV, which is a DNA virus. Transmission is through blood, sexual contact, contaminated needles, and mother to child. The pathophysiology follows a 4-step cycle. 1. HBV enters the bloodstream. 2. The virus infects hepatocytes. 3. The immune system attacks, resulting in acute hepatitis. 4. Chronic cases can lead to cirrhosis or hepatocellular carcinoma, which is HCC. Finally, HBsA, the hepatitis B surface antigen, is a marker of infection. If HBsA is positive, it indicates an active infection. If HBsA is negative and anti-HBs antibodies are positive, it indicates recovery or immunity.
Thank you for your attention.